Welcome to Wellness Health Services, Health Talks. I'm Dr. Joshua Derito, a family physician with interest in cancer prevention and public health. Did you know that 85% of the lung cancers are caused by smoking? So let's look at lung cancer. We are going to look at what happens, how is lung cancer occurrence globally, how do we stage lung cancer, what are the various types of lung cancer, how is lung cancer treated, and how can we prevent lung cancer. Lung cancer is a leading cause of cancer-related deaths globally. It is classified into two main types. We have the non-small cell lung cancer, which accounts for about 85% of the cases of lung cancer, and we have the small cell lung cancer, which is very aggressive in its nature. So let's look at the global statistics of cancer. Over 2.2 million cases of lung cancer are diagnosed every year in the world. And this is mainly attributable to smoking. The sad news is that over 1.8 million deaths occur from lung cancer. And this is mainly about 18% of all the cancer deaths. So the highest rates of lung cancer are in East Asia, North America, Europe. And this is especially attributable to smoking. So smoking remains the main risk factor to getting lung cancer. What happens is that there is abnormalities in the genes that are involved in the suppression of cancer growth, and they are activated from persistent irritation, either from smoke or other chemicals, and there is also suppression of the genes that are involved in cancer prevention. So there is environmental damage to the cells of the lungs from tobacco or environmental pollution or other cancer-causing risk chemicals. This will lead to uncontrolled growth of the cells, increased multiplication of the blood vessels, and then after the multiplication and the increase in the cells, there is a widespread distribution of the cancer cells in the body, which is called metastasis. What causes people to get lung cancer? As I've said, the biggest risk factor is tobacco smoking in all its forms. There could be snuffing, there could be smoking, and this can be active or passive. So those who live with people who are smoking, they are also at risk of getting lung cancer. So I think this is a public health concern, especially that you find that in families, the partners who might be smoking, and this is affecting the other partners and even the siblings. Then you have environmental exposures like pollution from various chemicals, and also asbestos form a big risk for getting lung cancer. Then there's also the genetic predisposition. People who have various types of cancer are likely to be at risk of various types of cancer. Then of course we have lifestyle, which include poor diet, which include poor intake of vegetables and fruits, previous history of lung diseases like chronic obstructive airway disease, diseases like emphysema. These form risk for getting lung cancer. So how does lung cancer present? Of course, the history will be persistent cough, and there could be coughing of blood, which is called hemoptysis. There is shortness of breath because of the blockage of the airways. There could be wheezing because of the compressive effect. You may have chest pain, especially with deep breathing. You have unexplained weight loss, especially that cancers are high metabolic conditions. You have fatigue and also loss of appetite. You have symptoms related to metastasis. This cancer can spread to the bone, and also you may have spread to the brain leading to abnormal neurological presentation like convulsions, vomiting, persistent headache, and also nerve paralysis. Then you have the staging of lung cancer. We have stage 1, which is localized in the lung. You have stage 2, where you have cancer in the local region, and there is regional lymph nodes around where the cancer is. Of course, there is stage 3, where there is a spread of the cancer to the mediastinal lymph nodes. Mediastinum is the central region of the chest. We have the lungs, and then you have the bronchus. So if the cancer now has moved from the lung tissues to the central part of the chest, the lymph nodes in the central part of the chest, that is stage 3. Then you have stage 4, where there is spread of the cancer to all the other body parts, from the liver to the brain to the bones, all these other areas. What are the main modalities of treatment of lung cancer? Surgery have a significant role, especially if the cancer is got early. You can have partial removal of part of the lungs, what is called lobectomy. You may also have a removal of one lung if it is affected, especially in early stage non-small cell lung cancer. You have radiation, where radiation is used for localized disease and also for symptoms, especially if there is mediastinal symptoms causing symptoms. We also have chemotherapy. This is usually very essential for small cell lung cancer and also for advanced non-small cell lung cancer. Then you have targeted therapy, where drugs like erlotinib are used, and also crizotinib. Then there is also room for immunotherapy, where this is where modalities involving the immune system are used to try to slow down the multiplication of the cancer cells from the lungs. The complications include cough, which is persistent and it can be overwhelming. You have hemoptysis or coughing of blood, which can lead to anemia and difficult breathing. Of course, you have airway obstruction from the tumor, leading to difficulties in breathing. You have systemic spread to the liver, to the brain, and to the bones. And then you can also have treatment related surgical risk. It's complication related to chemotherapy, radiation. As we have seen in the previous videos, we talked about cancers like leukemia being caused by chemoradiation. So if you have undergone any type of chemo or radiation, then you are at risk of getting those types of cancer. So how do we prevent lung cancer? As I've said, 85% of the lung cancer are caused by smoking. So smoking cessation is paramount to prevent lung cancer, both active and passive. And of course also other types of tobacco use, whichever form. Environmental protection, especially reducing exposure and the pollution of the environment. Living a healthy lifestyle with balanced diet and also regular exercise to maintain normal body weight. Of course, early screening. The technology and the thinking is that for those people who have been smoking, using low-dose CT scans screening might be beneficial, and this is being explored so that those people who are at risk of getting cancer, the cancer can be detected early and the treatment initiated on time, where the response is likely to be good. So if you find this information helpful, please subscribe to our channel for more content, and I encourage you also to share within your circles so that we prevent this type of cancer. As you have seen, this is one of the types of cancer that can be easily prevented. So lung cancer is a major global health burden. Advances in early detection, targeted therapies, and immunotherapy are offering hope and better outcomes. Smoking is of major concern in causation of this cancer, both passive and active, and we should all work. Let's stop smoking to prevent lung cancer and all other types of cancer. Thank you for watching.